is Samantha Oakes, and I have a National Breast Cancer Foundation Early Career Fellowship. I am fascinated by the human body and I'm fascinated by disease, but my auntie died of breast cancer when I was a very little girl, and so I've always wanted to stop women from dying from breast cancer. The focus of my research is to understand the ways in which cancer cells learn how to survive in the body, grow and invade into distant organs. If I work out ways in which I can switch those cancers off, I can work out ways of stopping the cancer from spreading and hopefully curing the patient. So my research is basic research. I'm working out the ways in which cancer cells learn how to survive. We make incremental discoveries all the time, and hopefully those incremental discoveries will lead to ultimate wonderful outcomes for patients suffering with breast cancer. For example, some of the work that I've been funded by the National Breast Cancer Foundation in my training fellowship is now translated in a clinical trial for patients with breast cancer. So the work I'm doing now, I hope, will make a real difference in the next 10 years of enabling breast cancer patients to survive long term and essentially die of old age. Okay, the biggest challenge facing me as a breast cancer researcher is learning the many ways breast cancer cells learn how to survive in the body and spread to distant organs. Breast cancer is not just one disease. Like all cancers, it actually is multiple diseases. So understanding the ways in which we can kill cancer cells for a wide range of patients is the real challenge. The first thing people do when I tell them I'm a scientist researching breast cancer is they say, "Wow, what a great job." And then they ask me, "Are you making any progress?" And I have to tell them, we make discoveries all the time. Little incremental discoveries will make a difference in at least one person's life in the lifetime of myself. So I hope that by the time I end my career, if I've at least saved one patient, I've lived a good life. I have experienced changing my research over the course of my projects many times. Sometimes we discover something that's unexpected and we have to chase that down a different path, and that's certainly been the case with my research. The research I've been doing at the moment has been trying to understand the way cells survive in the body, but it's led me to understand how cells metastasize and spread to the rest of the body, and that's really where we're going to make a difference for treatment of patients suffering breast cancer. One of my biggest discoveries was learning that a therapy that could be used for patients suffering blood-borne cancers, that is leukemia and lymphoma, can be used to treat breast cancer patients. It can be used to sensitize them to chemotherapy that they may not ordinarily respond to. The funding that NBCF provides researchers in Australia is absolutely crucial. There's just not enough money that the government provides researchers in this country to go around for all the fantastic researchers we have here. National Breast Cancer Foundation provides not only important funding for project grants, but also provides funding for innovative research that might change the course of treatment for patients suffering breast cancer. And also importantly, they fund early career researchers like myself to start their independent research career and actually be able to make a difference in the treatment of patients suffering breast cancer. I've been funded from the National Breast Cancer Foundation since 2008 on 2 major fellowships, and I've also had funding on projects. Without the National Breast Cancer Foundation, I may not be standing here today as a medical researcher and a researcher making a difference for patients suffering breast cancer. Funding is absolutely crucial for us to conduct experiments in the laboratory, for us to do the work that we need to do, for us to employ brilliant people that are able to help us make those really fantastic outcomes for breast cancer patients. Without funding, we wouldn't be here, we wouldn't be able to make these incredible discoveries. The biggest breakthrough in breast cancer research to date, that is really challenging. Look, I think you cannot go past the discovery of tamoxifen and the benefits that tamoxifen has given to patients who suffer estrogen receptor positive breast cancer. That's about 70 to 80%, so 7 or 8 out of 10 patients will benefit from tamoxifen therapy because they've got an estrogen receptor positive disease. The trick now is to really understand how we can treat those 20 to 30% of patients that don't express estrogen and don't respond to hormone therapy. I sincerely hope that we see 0 deaths by 2030. But we've got a long way to go. Breast cancer is a very complex disease like many other cancers. It's not just one disease, it's multiple diseases. So without National Breast Cancer Foundation funding, we just simply wouldn't be able to achieve that. We need more funding to try and achieve that goal.